Good evening to you on this Friday night. I'm Lauren Maloney. We start with our coronavirus coverage. Hospital leaders in Lamoille County are standing by their decision to not inform the public about a COVID outbreak among employees. They believe notifying the state, which they are required to do, was enough. As Local 22's Mike Hoey shows us tonight, it is Copley Hospital in Morrisville, and Mike is live in the newsroom.
Well, Lauren, even though the outbreak led to 5 employees getting infected, there's no reason to believe the virus ever got into the main hospital building where patients are cared for. The Morrisville News Citizen was the first media outlet to report all of this. In early January, a Copley employee who does not work in the main hospital building complained of sniffles. Within hours, infection control nurse Jody Legacy interviewed everyone in that department and arranged for thorough testing and cleaning. 5 workers tested positive. They've recovered and are back on the job. In a memo which the News Citizen has published, Copley administrators wrote, quote, "In-person patient contact is not part of their job. In fact, they do not spend much time in the hospital building at all." The hospital notified the Vermont Department of Health exactly 1 month ago on January 12th, apparently without intending to tell the general public. Jody Legacy told the News Citizen, quote, "I don't have to report it to the community, but I have to report it to the health department." CEO Joseph Wooden, quote, said he is not inclined to release everything directly to the public, citing shaming and patient confidentiality, despite the fact that staff, not patients, were involved. In response to a public records request from reporter Mike Donahue, the health department recently furnished a list of Vermont COVID outbreaks, including one at an unnamed hospital. 2 weeks ago, Health Commissioner Dr. Mark Levine was asked why that hospital wasn't named.
Many of the more anonymously listed places on the list you have are because of potential violations of personal and patient confidentiality.
The size of an organization and the percentage of people there who've been infected are also factors.
There are a whole variety of epidemiologic considerations legally supported that go into determining if we can actually put a name next to a certain number of positive cases.
Dr. Levine also brought up another element that Wooden referred to.
We also, clearly know of many businesses that have been stigmatized and received the brunt of criticism that they didn't deserve just because they happened to have cases.
Health leaders have since revealed Copley was the unnamed hospital. Now, when I called Copley myself this afternoon to ask administrators for an interview, an operator transferred me to Human Resources. My call went straight to voicemail there, and no one has returned the message I left. Live in the newsroom tonight, Mike Hoey, Local 22 News.
Now to the numbers in Vermont with 162 new cases to end the week, 44 of those in Chittenden County.